All right, welcome and thank you for engaging in this discussion with us today. You are our partners in human rights, and we could not do any of what we do without you. So thank you for being with us today, taking some time out. I'm Ed Stellan. This spring, I stepped into the role of Chief External Affairs Officer for Heartland Alliance, but I've been at Heartland Alliance for a long time, almost 32 years, and I've held a few titles. Most recently, I served as the Executive Director of Heartland Alliance Health. So during my time at HAH, Heartland Alliance Health, we addressed many challenges, but none as large as the COVID-19 pandemic. The pandemic affected all of us, but as we know, it took a disproportionate toll on the most vulnerable. Although the Biden administration announced an official end to the COVID-19 public health emergency on May 11th, 2023, discussions about the aftermath of the pandemic are more critical now than ever before. During the public health emergency, you'll often hear it referred to as PHE in our discussion today, the public health emergency. Policies were put in place that created a more equitable and livable situation for many vulnerable groups. Many programs built to support individuals living at or near the poverty level were modified and expanded during the pandemic, but those are now being rolled back, leaving people in vulnerable positions. During the first week of August, more than 47,000 Illinois residents lost Medicaid coverage, 47,000. And it's estimated that this number may grow to as much as 700,000. In 2021, in the midst of the pandemic, the Impact Research team at Heartland Alliance released a signature report on the domino effect caused by COVID-19, outlining how losing one support can cause others to crumble away for those already living on the edge when disaster strikes. Vulnerable people often rely on many different mechanisms. When one of those things go, it's like a house of cards. Today, we'll be discussing the recently released 2023 report, which explores the aftermath of the pandemic with a specific focus on how communities of color in Illinois have been particularly affected. We will focus on health and economic well-being specifically, and what implications of unwinding COVID-19 era benefits means for Illinoisans. It's especially important to those of us who have dedicated our careers to advancing equity in Illinois. It's important for us to understand the impact of policy and policy change on the lives of our state's most vulnerable residents. We are all in this together. Today's discussion is meant to provide us with useful information. It's meant to inspire us to use that information as we work collaboratively to promote equity in our communities. Before we begin, I want to note that we'll have a Q&A at the end of the panel. We really see you as partners. We hope to incite a bit of discussion, conversation after the panel, so please use the Q&A function. You'll be able to enter the Q&A, your questions, in the Q&A box. I think it's at the bottom. In my screen, it's at the bottom of the screen. So, now I am really excited. I feel so lucky to get to work with amazing people here at Heartland Alliance, and I'm excited to introduce three of them to you. So first, we have Jen Cooper. She's Senior Director of Research and Analytics at our Social Impact Research Center, and she's also one of the lead authors of the report we'll be discussing today. Steve Schultz is program manager of Chicago Farm Works. The Chicago Farm Works is the second largest urban farm in Chicago, and it produces 30,000 servings of organic produce for people facing food insecurity. And Sheena Ward, Inglewood Health Center manager. The Inglewood Health Center at Heartland Alliance Health served 1,544 people so far this year. So I'm really excited to get to showcase their amazing work with our audience today. Jen, I'm going to start with you. As the lead author, researcher for the signature report, can you share some of your most impactful findings?
Sure. Thanks, Ed, and good morning, everyone. Thanks for being with us. This is really exciting. So this report that we are talking about today really infused a lot of different things. When we started this report, we knew that new data from the US Census Household Pulse Survey was going to be really important in helping to tell and contextualize our story, specifically within our state of Illinois. We also added in all of these updates that were happening throughout the last year with these rollbacks, because we know that it's been a very dynamic time and things have been changing pretty rapidly. We decided to break the report out into 3 different sections because those 3 sections were really the big things that were happening with these rollbacks. And those sections were healthcare access, telehealth, specifically in the context of mental health and substance use disorder, and also food access. So for today, I'm going to share findings within those kind of brackets. So let's first start with healthcare access. This was probably one of the largest changes that we have seen with the PHE rollback. In 2020, the government allowed for a temporary 6.2% increase in the Medicaid match rate. And basically what that meant was that states could get more Medicaid dollars if they followed a variety of stipulations, one of which was allowing Medicaid recipients continuous enrollment. So pre-pandemic, there's a variety of different ways that people can get onto a Medicaid benefit program, but annually, most of them need to go through a redetermination process. During the pandemic, that process was in essence put on hold. And so we saw continuous enrollment. We had really no Medicaid churn, and we also had an overall increase in coverage. As of May 2023, which Ed mentioned, this process has ended. So people have to go back through the redetermination process. We are back to pre-pandemic Medicaid processes, more or less. And like Ed mentioned, it is estimated that within our state alone, Illinois, between 384 and 700,000 individuals will lose their coverage because of this process. Also, like Ed mentioned, we know that as of August 1, 47,000 have been kicked off of Medicaid. So this has huge implications for the populations that we serve. We also, in that same section of the report, talked a little bit about long COVID. Long COVID is a really interesting illness. Long COVID is usually something that comes about after a COVID infection. Some people have continuing symptoms. And so we wanted to spotlight this because it's in essence another novel illness, and we wanted to take a deep dive and look and see what was going on. So in the state of Illinois, there are really disproportionate rates of long COVID among people of color. Not surprisingly, this follows a national trend. And so really what that tells us is that when we have these issues with Medicaid coverage, combined with continuing COVID-19, combined with long COVID, combined with everything else that we have in our healthcare system and within our health life, this really is the recipe for the perfect storm. The second portion was in telehealth. And this was some positive findings. Telehealth really emerged as this beacon of light during the pandemic because it allowed people to stay home and still receive medical care. And it allowed for a variety of really vast flexibilities. We were able to change the way we prescribed medications. Medications not previously allowed to be prescribed via telehealth now are able to be prescribed. We were allowed to code certain types of appointments to telehealth appointments. So it really changed the environment. Pre-pandemic, out of all outpatient visits, approximately 1% of those visits were telehealth. At the prime of the pandemic, a little over 40% were telehealth. So you can see that there's been that huge upshift in people utilizing telehealth services. This was especially useful for people seeking mental health and substance use disorder appointments because of those 40% of telehealth appointments, approximately 36% were for mental health and substance use disorder. So huge game changer in that space. Fortunately, in July of 2021, Illinois signed into law HB 3308, which is a law that retains a lot of our telehealth flexibilities. So amazing news on the telehealth front. The last part of the report was on food insecurity, and this is also an area that changed pretty significantly with the rollbacks. So during the pandemic, the government expanded SNAP benefits. SNAP benefits are in essence our food stamp program, and it allows individuals and families to get monthly allotments of money to buy groceries and other household items that are eligible under SNAP. During the pandemic, the government increased benefits. So individuals were receiving more monthly benefits to go towards these items. Let's see. On average, each SNAP participant now will be losing about $82 a month because as of March, we are ending that additional benefit. This will most impact older adults who will go from receiving a minimum benefit of $281 a month during the pandemic with this increased benefit to now $23 a month. That is a substantial decrease in the monthly benefit, and that has huge implications for our ability to purchase food and our buying power. We know that this is especially devastating because food prices have gone up significantly, which I'm sure all of you have experienced yourself. A dozen of eggs alone has gone up 137% in price since 2021. Similar to what we saw when we did our analysis on long COVID, we also know, and again, this is not surprising, this is national trends, that food insecurity in Illinois is much more prevalent in households of color. And individuals that are self-reporting as Black and Latino have almost double the rate of food insecurity within Illinois. So those were the high-level findings, not to leave on a negative note, but those were the big key takeaways from the report. I'll pass it back to Ed.
Thanks, Jen. And at HAH during the height of the pandemic, we started using telehealth at the end of March of 2020. And even with our population of people experiencing homelessness, we were shocked at the uptake, especially with behavioral health. At Heartland Alliance, we really believe in eliminating barriers to care, improving access to care. So Medicaid, health insurance provides access, and alternative mechanisms to get into care like telehealth are really important too. So thanks so much for that, especially vegetables for our communities. So Inglewood is one of the communities that gets produce from farm works, and it has similar barriers to medical care and food access. Steve was mentioning it broke up a little bit, this notion of a food desert, having to go half a mile or more to get fresh fruits and vegetables. Sheena, you manage our health center in Inglewood, a community that's unfortunately boasts the largest life expectancy gap in Chicago. And Chicago, sadly, has the largest life expectancy gap of any city in the United States. So between Streeterville and Inglewood, we see a 30-year gap in life expectancy, 30 years. You help community members gain access to healthcare. How are some of the ways we're combating barriers to healthcare as policies change? What happens to our participants when they're no longer eligible for these services? I want to really applaud you for your work in being proactive and making sure our folks are able to hold on to all the benefits to which they're eligible.
Thank you, Ed. Yes, and when individuals are not eligible for services, we still have the ability to provide healthcare services to them, regardless of their ability to pay or their eligibility status with insurance. But we do have a robust benefits and entitlements program that supports all 3 of our health centers and our shelter-based care, which is essentially our 4th health center. So we're doing a variety of measures to make sure participants do not have issues with their Medicaid and their Medicaid redetermination, which is now in effect after the PHE end. So basically we do a lot of partnering both internally and externally, one with our MCOs, County Care, Molina, and some other of our Blue Cross Blue Shield they send lists to us, of which we work in conjunction with our revenue cycle management team, which is our billing team, to contact all of those individuals on the list, even if they haven't been to us in the last few years, to let them know that they have an upcoming redetermination. And this really helps because most of our population are experiencing some sort of homelessness or some sort of transitions, kind of monthly, weekly, or even daily. We also have collaborations with our front-facing staff, so our case management programs that have a little bit more of a closer relationship with those participants that help us advocate and get access to them so that we can provide assistance with completing those applications, the redeterminations, either faxing the information over or filling it out through the ABE system, through the Manage My Case portal. Additionally, the Benefits and Entitlements team have on average 12 slots at each health center to provide enrollment assistance with understanding your coverage overall. And then also we do a lot of info sessions with our staff so they can understand the impact of losing their coverage and the different dates that may come to the participant. And then we also have shelter-based care benefits and entitlements assistance where they go to each sites, which we know those sites pop up weekly for the shelter-based care team. So we go where the most need is. So nearly half of our Inglewood residents are on public assistance, including Medicaid, which is about 55% of residents, and the highest in the city of Chicago. So the Inglewood community is including high cycle users, folks that may use the ER, may use our services, not on a monthly basis, not on a yearly, annual checkup, but have crises that need to be attended to because of their health and the decline in health that they have. Also, young people use it seeking contraceptive care and STI treatments. And then also our LGBTQIA plus community with a number of complex needs, gender confirming, medications, and so on and so forth. And all of and it just said with Inglewood, all of our community is just a subset of what we provide care to on a daily basis. And our care is pretty holistic. We provide mental health and dental to adults, as well as therapy, medical to both children and adults. As I mentioned, benefits enrollment assistance, specialty referral coordination assistance, case management. Also, what makes us unique is that shower and laundry services, just having a hot shower or being able to wash your clothes. You don't understand how much these general things that we do on a daily basis can really impact our community and impact our participants in a positive way if they have access. We have an on-site pharmacy at the Inglewood Health Center. And then once a week, we do have Fresh Moves that we have partnered with to come and provide organic produce at a very, very low cost. And they also have a SNAP match program up to $25. So what we're trying to do is increase our impact, increase our expansion, because our physical space, we're growing out of it. And then also we're listening to the community of what their needs are. And there's a need for integration of contraceptive care into primary care. So this initiative would allow HAH to meet an ambitious goal across all three of our health centers of serving 20,000 unique individuals annually by 2030. Including the 9,000 people reached on the South Side, which is a 200 increase of the population that we serve. Thank you, Ed.
Thank you, Sheena. That was awesome. And one of the things that I took from that is just the very individualized, collaborative, relational approach that HH has with its participants. And I love the way you're leveraging the connections that providers have with their participants to get our participants to understand the redetermination process and engage in that. It's amazing. I am going to let's do a quick check here. Steve, I would love to invite you back. I think we've got like a good little 5 minutes here, because then we want to move into questions and answers too, and give people some time for that. But I wonder, let's test and see if we can hear you.
I may only have 5 minutes of good audio here, so maybe that's perfect. Yeah,
You sound really good right now.
I do. We'll see how long this lasts. Well, let me just pick up a little bit where I had left off. What we're doing at the farm to address some of these, the food insecurity and the nutrient insecurity, is we're working with a couple methods. One is we're working, of course, with Vital Bridges food pantries in the north-south and north-south and west side. We're also working with what's called Love Fridge organization or project, and we deliver food into a fridge that is about the size of something in your kitchen. And it's about as basic and direct as you can imagine. You put good, healthy food in there. People can come, whoever needs it, and take the food out. There's no intermediate, like anything there's an obstacle in between to the Love Fridge. And we have noticed that we put some of the food in there Monday. By Wednesday, when we deliver again, it's already gone. So we know that that's there. Another thing that we're doing right now is partnering with the Morton School, which is kitty corner from the farm, getting kids on the farm, getting them with their hands in the soil and the compost, developing that relationship at this age with the relationship with food can help with issues of food insecurity later on. If nothing else, if they're able to embody or just have that with them as they grow, they can be an active member of fighting food insecurity, the purpose of food and understanding how it's grown and the meaning that it has for all of us. And when we think of how much time, Ed, I just want to make sure I'm not going to, are we good? Okay. And a little bit of, we know with a lot of these Bridget supports that are disappearing, that that stress and that trauma just surfaces all the time. And what we find at the farm with our participants is that as they bring a lot of weight and that trauma with them when they come onto the farm, they're finding the farm, the green space, as a piece of a respite and calm for them, a transition piece from not having full-time employment and a peaceful transition into getting used to coming to work every day. And this all comes back from feedback from our participants. A lot of them also connect to the history they have and the memories they have of either gardening, growing food, or farming in their past as a child. So we see the farm being able to play that role a little bit with our participants versus being in a factory somewhere, just being amongst trees and birds and soil and compost and nurturing plants as they go.
Oh my, Steve, you were on a roll. I took a lot I actually was taking some notes from what you were talking about. What we're going to do is kind of roll through this, and I'm going to go to our final wrap-up question. But I do want to just pull out something that I heard from Steve. This notion of nutrient insecure, that this isn't just about calories or quantity of food, but it's also about the quality of food, organic vegetables, understanding where your food is coming from, being part of the journey from farm to table. That it's amazing. What an amazing story. So I want to first thank you all for sharing these impactful ways that we're serving communities across Chicago. And as we adjust to the changing federal and state supports, in a moment, we'll go into Q&A. So please, everyone, leave any questions you have for our panelists in the Q&A box in the Zoom screen. Before we go to that, though, I want to open the floor to the panelists. Sheena, let's start with you. Are there any resources that you think our attendees today should be aware of?
Yes, absolutely. So the state has done a really good job with making sure that all agencies that work with our populations, vulnerable populations, have toolkits to prepare them for the redetermination. They have a call-in lines, they have a number of lines for all kids for changing of your addresses, for applying for benefits or checking your redetermination status. Because as I mentioned before, a lot of our population is very much so transient. And that could also be the same for most people that are on Medicaid, where they don't have an address available for them. So the state has really partnered with a lot of agencies like ours to make sure, and then along with other agencies like Illinois Primary Healthcare Association that has sent out marketing materials and tools for engagement, so we can engage our participants. We can let them know where they need to go. If they can't reach us, we can guide them in this process so it won't be daunting. And I think it is valuable to know that the state doesn't want people to lose their coverage as well, that they are invested in making sure folks like who we provide care to sustain all of their public benefits that they're eligible for and in need of.
You know, Sheena, you make a good point. Medicaid enrollment is not just good for the enrollee, it is really good for Illinois. And the more coverage we have across this state, the more insurance coverage, the better we are all off. We all are off. Whatever. I think people understand what I'm trying to say. But thank you. Thanks for that. And Jen, what are some of the ideas that you can share?
Yeah, so in regards to resources, there's two big ones that I like to send people to with food access and SNAP benefits. The Illinois Hunger Coalition is a really good one. They have a hunger helpline or hunger hotline available in English and Spanish. You can go on their page, give them a call. And when your SNAP benefits go down, or they've already gone down, so when you start really having that hit, you can access that and they can help you get additional resources, link you to food pantries, variety of different resources on that page. They also have some really good informational material there to learn more about benefits and getting benefits, keeping benefits, all that good stuff. The GCFD, the Greater Chicago Food Depository, possibly we have some friends on the line from there. They also have a really good resource page. They have an option to seek out food pantries and, again, other spots where, should you not have enough money from your SNAP benefit on a monthly basis and you need more food or whatnot, those are some really good spots to go to.
That's great. Thank you. Thanks, Jen. And in terms of other things that people can do, you know, from the Heartland Alliance perspective, first of all, thank you for joining us today, because just getting information out there and partnering and collaborating, that's the way that we will promote equity and opportunity for all. And that is Heartland's mission. So always, if you want to ever get more involved, donate resources, time, money, items, you can check us out on the heartlandalliance.org website. And, you know, when we all get a lot of email, but click on those emails from the HA policy team. We'll alert you to changes going on in our state. So I'm going to turn our attention now to questions from the Q&A. And let's see here. I think we have a question. The first one is for Sheena, I think, here. Let me just move my screen a little bit so I can scroll here. Sheena, can anyone get help with assessing their Medicaid eligibility through Heartland Alliance Health? Where else can they go?
Yes, most individuals can get assistance with our benefits and entitlements team. It is a resource within our health centers for folks that are receiving care through any of the Heartland Alliance programs. So we welcome all new participants. If that is something that is not, if they have a different primary care provider elsewhere, but just need the resources. There are numbers that they can call. They can definitely call County Care, and County Care does have a hotline where they assist with applying for benefits. There is a number of other hotlines that assist with applying for benefits. And then, as I mentioned before, the ABE website, where a person can go on if they are computer savvy and apply for benefits, track their benefits through Manage My Case. And they're pretty much the holder of their resources and their benefits. And then they can choose what office they want their case to be at. So it's a number of ways that individuals can access assistance.
Great, thank you, thanks. And I know you've mentioned to me in the past, Sheena, that people can get telephonic support too. So for some of our folks who aren't computer savvy,
Yes.
there's the telephonic support, and our state's been really good about that. I think there's a concerted effort to really get the word out and try to ensure that people continue their coverage. We have another question too. And Jen, we're going to start with you with this one, I think. Do you anticipate this latest wave of COVID infections to impact policy change or services? It's a good question.
Great question. Yes, I don't know if it's even this latest wave. And I'm wondering if this question is in regards to like mask mandates or along those lines, or perhaps more broad. So Sheena, you might have more context for what is happening kind of in the clinic space with wearing masks again or whatnot. I mean, I think, we know that the pandemic in general has, as you saw from this presentation and in the report, this has huge implications for policy. And this is kind of a point in time, but this is going to be an ongoing thing. We're going to see ripple effects from this forever. I mentioned long COVID. I think in regards to services, there's going to be a lot of things that come out of people getting infected from COVID. Long COVID is one of them, but there's those domino effects. And so that's going to affect policy. That's going to affect the way that we serve our populations. But no, we're seeing this right now. And so I don't know if this final or this latest wave necessarily is going to have like a big hit. I think it's the greater sum of everything that we've kind of been experiencing. But maybe I can pop it over to Sheena. Sheena, maybe you could speak a little bit more to the granular nature of if this latest wave is enforcing additional mask mandates or whatnot.
Absolutely. So our senior leadership team is still rolling out that COVID plan and COVID policy, like post-COVID, even though we're still kind of in the thick of it. So we are still mask mandated right now with our staff members and encouraging our participants to still wear masks when they're in the clinic. But a new policy is slated to roll out very soon. We work in conjunction with HA when we roll out, or Heartland Alliance when we roll out any of our policies. So there's still some things that we're working out there. So right now it is mandatory for all of our staff, and it highly encouraged for our participants to wear when they're on site receiving services.
Thanks for that, Sheena. And it does seem to me that I hope that a learning from the pandemic is that masks can be valuable whenever there's a flare up of anything in our community, COVID, flu, things like this. So thanks for that. And our final question, Sheena, I think I'll lean on you for this one. Will the new updated COVID vaccine be available at HAH, Heartland Alliance Health?
So our nursing team, which is an amazing team,
they are.
it works very closely with CDPH
Yeah.
with our vaccination process. We actually got a new internal process where it's a scanning system where they can, monitor how many vaccines we have, what's in, what's out. And right now we're in the thick of flu season because flu season has kind of taken a back seat to COVID in a lot of ways, but still significantly impacts our population. So we just rolled out our flu vaccines for peds on 9/11 and adults today. So the COVID vaccines are here. Still, the new vaccines, I believe they're still working out some of the processes with that, but folks are able to get their booster shots still. There is some type of compensation because we live in we're servicing a population that's sometimes vaccine hesitant. So we do have some vaccine hesitancy money that has been invested with gift cards if an individual gets that booster and they are up for their booster, because that's the number one thing. They have to be ready for the booster.
Got it. Thank you. And I know we're coming close to time, but there is one more question. And this one is for Jen. Is there any cost benefit analysis comparing application and redetermination recertification for SNAP and or Medicaid during the pandemic compared to regular requirements to make the argument that simpler administration for both programs may be more efficient?
That's a great question.
It is.
And there's a lot there to unpack. I would say yes. I know the Kaiser Family Foundation, for example, is doing a ton of work within the Medicaid space. I know that this is a really big thing for SNAP as well. So there are active studies going on. We actually, in the Social Impact Research Center, not necessarily a cost benefit analysis, but we have a study taking place looking at the churn within Medicaid and health outcomes. So we will be able to hopefully show that, this redetermination process has a negative impact on health outcomes. And so that motivates future policies and how we do our Medicaid programming and what that means for the population that we serve. So there's a ton of research within the space, and the cost analysis work is being done. The one that I know off the top of my head is with Kaiser. The other thing too I'll mention is that we are in census week, which is really exciting for anyone that loves data and loves kind of these like big data dumps. So the census is releasing new data yesterday and tomorrow. And so we are getting in real time information on poverty rates and how, kind of where we are as a nation, the well-being of our population. And in essence, all of that is coming out of the pandemic as well, the different data that we're seeing there. So I think as new data comes and as we get further into this rollback process, there's going to be a plethora of data, a plethora of research, tons of studies that are going to be being done. But for this particular one, the one off the top of my head is Kaiser Family Foundation. And then our work as well.
Yeah, absolutely. And a last minute question just came through. I know we only have about a minute here, and then I'll close us out. But is there anything we as a community can do to influence the state to raise the SNAP benefit amounts?
Yeah, that's a good.
These benefit amounts are very low.
That's a great question. And I am by no means a policy expert. So I would ask if anyone else on the call, Ed or Sheena specifically, wants to weigh in. But I mean, we have to just continue pumping out the research to advocate for the state to fill in where the federal government cannot. So we've seen this before. Moving forward, we would love to see this again. But yes, the SNAP benefit that is currently being allocated at a monthly basis is very, very, very low. And there's like tons of things that feed into this, right? The way that we calculate that benefit is antiquated. the way that it was just kind of pulled back out of nowhere was not a great process. It didn't allow people the time to kind of get ready for that. If you could even get ready for a huge reduction in your buying power. So yeah, I mean, we have a ton of work to do, and that's a really big question to unpack. But whenever we can advocate for the state to help fit in again where the feds cannot, that's the way to go. But I invite Sheena and Ed to weigh in if you have anything else.
Yeah,
Mhm.
with this SNAP advocacy project, so there's a group of SNAP advocates, and it's led by the Greater Chicago Food Depository, and they do a lot of policy work. They give a lot of information to organizations like ours of what we can do and what's coming down the pipeline. And they meet Fridays, I forget which Fridays, but like at 10 a.m. And you can request to join those teams, especially if you're working in the community and in different community organizations. And the Illinois Hunger Coalition does a lot of advocacy work as well.
That is great. I know we've come up on time. We're actually 1 minute over. Great note from one of our attendees, the SNAP benefit is regulated at the federal level. This is a Farm Bill authorization year, so it's a good time to call your member of Congress. So, a great opportunity to advocate at the federal level, in addition to trying to get our state to look at that gap and fill that gap. So I'm going to close us out. I want to just start with a thank you to everyone who joined us today. Really, really grateful for our esteemed panel. And you can you can always go to our website and check out opportunities to learn more, donate, volunteer. The FarmWorks program is always happy to host volunteers if you want to check that out. I've been there, it's amazing. And we will be sending a follow-up email too, and ways to contact us, keep up to date with our work, and to support in any way and partner. So we deeply appreciate your time, and we hope you have a lovely rest of your day. Thank you so much.